So, good afternoon, everybody. We are Group 2, and today we are going to present the topic is atherosclerosis and ischemic myocardial disease. So, here is our content page. Throughout our presentation, we will first introduce what this disease is. After that, we will talk about the etiology and risk factor. Then, we will talk about the pathophysiologic mechanism, the development, signs and symptoms, therapeutic measures, and lastly, we will talk about the current and future prevention of this disease.
For the introduction of atherosclerosis, the thickening interval lining of the large and medium-sized artery due to accumulation of fatty material and formation of fibrous peak may lead to stroke, coronary artery disease, ischemic myocardial disease, and peripheral artery disease. Atherosclerosis and ischemic myocardial disease are associated with the cellular response to stress, acute and chronic inflammation and disorder of the blood flow.
For the etiology of atherosclerosis, it is a complex disorder with unknown exact cause. However, the epidemiology studies have identified those predisposing risk factors. Some of these are innate, which cannot be changed, while others are affected by lifestyle and modifiable. For the non-modifiable risk factors, firstly, the male who doesn't have enough secretion of productive estrogen are at greater risk for the development of atherosclerosis. Besides, incidence of atherosclerosis increase with age. Genetic alterations in lipoprotein and cholesterol metabolism leading to hypercholesterolemia may cause the accumulation of lipid and formation of plaque in arteries. Finally, family history of premature coronary artery disease or stroke due to atherosclerosis are also at greater risk than those with a negative family history. When it comes to the modifiable risk factors, cigarette smoking has negative impact in hemostatic and inflammatory effects and enhance the oxidation of low-density lipoprotein cholesterol, causing damage to the endothelial lining of blood vessels. Obesity, type 2 diabetes, high blood pressure, high blood triglycerides, and low high-density lipoprotein levels, which are all components of metabolic syndrome, are also the risk factors that can be changed in healthcare behaviors and medication.
So, there are 4 stages of pathophysiologic mechanism. The first stage is endothelial cell injury. The second stage is migration of inflammatory cells. The third stage is lipid accumulation and smooth muscle cell proliferation. And the last stage is plaque structure. So, according to the American Heart Association, there are 6 types of development for these causes. The first type is isolated form cells. The second type is fatty streak. Type 3 is small extracellular lipid pool. Type 4 is atheroma formation. Type 5 is fibroatheroma, and type 6 is complicated surface.
So I will talk about the signs and symptoms of atherosclerosis. So first of all, the symptoms of atherosclerosis usually takes more than 10 years to develop its symptoms. So at most of the time, the patient do not cause any symptoms until the artery is completely narrowed or get blocked. So the disease will remain undiscovered until the patient has severe medical emergency. So like heart attack or stroke. So they will get sent into the A&E, and people will still have various symptoms, however. So it will depend on the affected arteries. For example, like coronary and renal and peripheral artery. For the coronary artery, one of the common symptoms is angina, so it will occur when the heart muscle doesn't have enough oxygen. So it is a sensation of pressure and squeezing, sometimes indigestion in the chest. So the pain can also be felt on other part of the body, like the jaw and the back of the upper body. So emotional changes can also trigger the pain. So other symptoms for the coronary artery, including shortness of breath. And second affected artery is the carotid artery. So the route of the blood is from the heart to the brain. So when the brain does not receive enough oxygen-rich blood, it will cause numerous symptoms like sudden weakness, confusion, and loss of consciousness. So it is the symptoms that indicates the possibility of stroke. So for the affected renal artery, it is the symptoms that are often seen in older people, because for this disease there are no symptoms in the early stage. So the symptoms will worsen over time. For the major symptoms, one thing to be noticed is the high blood pressure. As renal artery will affect kidney, as kidney lost its function in the late stage, it will also lose the function of controlling the blood pressure. So there are also minor symptoms like tiredness, loss of appetite, and swelling in the hands or feet. So these are the symptoms of affected renal arteries.
Peripheral artery disease is the narrowing of the peripheral artery to the leg, stomach, arm, and head. It's most commonly in the leg arteries, and when plaque builds up in the body artery, the condition is called atherosclerosis. Over time, plaque can harden and narrow the arteries. This limits the flow of oxygen-rich blood to your organs and other parts of your body. The classic syndrome of PAD is pain in the leg or feet that disturbs sleeping, and the color change in the skin of the feet. And the last one is the sores or wounds that heal slowly, poorly, or not at all. So how can we diagnose atherosclerosis? There are three methods. The first one is a physical exam. We need to listen to the artery for an abnormal vision sound. And the second one is blood test, check the level of certain fat, sugar, and protein in your blood. Abnormal level may be a sign at the risk of the atherosclerosis. The last one is the Doppler ultrasound to measure your blood pressure at the various points along arm or neck.
Now we move to therapeutic measure. So the first therapeutic measure is the percutaneous coronary intervention. The percutaneous coronary is a procedure that used to open, block, or narrow coronary artery. The percutaneous coronary intervention can improve blood flow to the heart and relieve chest pain. A small mesh tube called a stent is placed on the artery to keep it open after the procedure. The second one is coronary artery bypass grafting. The coronary artery bypass grafting is a type of surgery. In this surgery, artery or vein in our body are used to go around our narrowed coronary artery. This surgery can improve blood flow to our heart, relieve chest pain, and prevent a heart attack. So the third one is the bypass grafting. The bypass grafting also can be used for leg artery. In this surgery, a healthy blood vessel is used to bypass a narrowed or blocked artery in one of the legs. The healthy blood pressure redirects blood around the blocked artery, which can improve the blood flow to the leg. So the fourth one is the chaotic endarterectomy, which is a type of surgery to remove plaque built up from the carotid artery in the neck. This procedure restores blood flow to the brain, which can prevent a stroke.
There are some current prevention to prevent the disease of atherosclerosis. The first one is the intake of small dose of medicine. And intake some cholesterol controlling medicine can lower our low density lipoprotein cholesterol, which can stop or even reverse the buildup of the fatty acid deposit in our arteries. And the second is the intake of the antiplatelet medication. For example, the aspirin can reduce the risk of the platelet which will clump in the artery to form blockage. And there are some future prevention of preventing the disease of atherosclerosis. These three kinds of is to change of the lifestyle. First one is to eat healthier. It can reduce the intake of fatty acid. For example, we can eat more vegetable fruits, and this diet is low in fat. And the second one is to do more exercise. The physical activity can improve our fitness level and reduce the amount of body cholesterol. And the third one is to quit smoking. If we smoke can damage our and tighten our blood vessels and raise the risk of atherosclerosis. Quitting smoking can reduce the damage to the blood vessels.